All right. Good morning, everybody. Welcome to the Chapter Support Committee Leadership Webinar. I'm Karen Saunders. I'm the ARN Chapter Support Chair and a nursing educator at Sheltering Arms Institute in Virginia. Welcome all, and thank you for joining us today. I know your time is valuable, so we're going to go ahead and start on time. If you have to jump off for any reason, we are recording the session for later use and learning purposes to share with your chapter members at your monthly meeting. We're very fortunate to have the knowledgeable and supportive Chapter Support Committee members on. We have Marianne Laszlo, who is the Board of Directors Liaison and a member of the California chapter. We have Beth Mooney from the Arizona chapter, Liz Squirrels from the sunny Florida chapter, Tracy Connolly from the Michigan chapter, and Nancy Steinbach from the Western Michigan chapter. We're also very fortunate to have ARN leadership team with us. We have Anastasia with us today, who is the marketing and membership manager of ARN and the staff liaison for this chapter support committee. And we're very excited today to have with us Maria Radowski, and I hope I didn't butcher her name, the president-elect and future president for the ARN Association. She will be inducted as the president in September at the ARN 2022 Rehab Conference. So welcome, Maria.
Everybody, thanks for letting me visit with you today. I'm interested in hearing what the Chapter Support Committee is up to. I don't want to hold up the meeting, so I just say hello. Thanks.
Well, thank you. We're glad to have you. We've heard from our membership and understand that engagement is one of the most difficult parts of managing a successful chapter. So we've pulled together an engagement webinar to provide added resources for chapter leaders. Speakers today include an outside voice from a different association who has successfully run a chapter in the past, and our own internal chapter leaders who have been successful navigating, as well as having some failures in their own chapters, to share their experiences and provide learning opportunities for us all. We will wrap up today's call with a discussion and introduction of our 2022 chapter scorecard, which you had emailed to you the latest version this Monday via email. This can also be found on our chapter resource section of the ARN website. We hope that everybody will complete the scorecard by September 9th. But for this in-service, please hold your questions and mute your phone so we can focus on the speaker's information without interruption. But we'd love to hear your thoughts during the in-service, so please add them into the chat. So please join us with our first guest speaker, Lee Zamora. Lee Zamora serves as the Executive Director of the American Association of Neuroscience Nurses, also on the American Board of Neuroscience Nursing, and the Agnes Marshall Walker Foundation. She has over 20 years experience in nonprofit management and has worked at AMC for over 9 years. She is part of the AMC community that helps manage ARN. Thank you for being here today, and the floor is all yours.
Perfect. Thanks so much for having me today. I know I've met a few of you, so I think we've chatted on a few times. So I'm here to kind of share a few things about the way ANN manages their chapters. So we are actually very similar to ARN in our structure. We also have a foundation, as you saw. We also have a certification. We are organized a tiny bit better, or not better, I should say, different, but very similar. So the first thing I'll touch on is chapter engagement at the national level. So we can go to that first slide, Anastasia. So at a national level, I'm going to just highlight a few things that we do to provide engagement for the chapters. So one thing we quickly noticed at the start of the pandemic is that we needed to pivot our leader calls. So we had quarterly leader calls, and what we had heard from the chapters was that they were not able to get together on a regular basis. They were having a hard time getting Zoom set up. So we actually took our chapter leader calls and made them all chapter member networking calls. So we initially started it every other month, and we've now kind of pushed it out to quarterly. So what we do is we actually come up with an educational topic, and we have someone present on that. So our last meeting, we actually had certification. So the value of certification, using it in your career ladder, those sorts of things. And then we've also built in an evidence-based question. So actually our board liaison to our chapter group will come up with an evidence-based question. And we've actually found this is really successful. So when we first started, Zoom networking was fun and people wanted to talk to each other. People, I think, are starting to hit that Zoom fatigue. So we found that there's a little bit more engagement around an article or a question or some sort of quiz that we can do that's really helps to engage. And we don't get a ton of people on the calls. We invite about 900. We see somewhere from 30 to 50, but we figure it's a resource. It's out there. We want to keep putting it out there. So that's something ANN will continue to provide for our chapter members. The other thing that we do at a national level is we have an award for our chapters. So it's the Outstanding Chapter of the Year Award. So it recognizes an outstanding chapter that supports and advances the activities of ANN. So it's given an acknowledgement of the chapter who has innovative and contributes to neuroscience in evidence-based areas, as well as the complete innovative projects. So in the area of education, health promotion, or other areas identified by the chapter. So what we do is we have them submit an application. They kind of cover what their chapter was doing. In preparation for this call, I actually read through the applications just to kind of see what different chapters we're doing. And I'll touch on that kind of a little bit when we talk about individual chapter engagement, but it really is, like symposiums, raising funds, doing service projects, those sorts of things. So they do actually receive a $500 stipend. And then we ask them to present at our annual conference, and we actually ask them to present virtually as well. So we saved a spot for them at that chapter networking call and asked the Eastern Iowa chapter actually just presented their work. The other item that we've done to engage our chapters is we have a lot of activities around supporting our foundation. So in the past, when we had in-person meetings on a regular basis, which hopefully we'll all be getting back to soon, we'll actually do a chapter raffle. So the different chapters would put together a basket kind of based on their area and bring it to the conference. From a staff perspective, not the best thing to organize, and it's not always fun, but I will say the chapters are really engaged, are really excited to represent their chapters, and they love supporting the foundation. So I think it's, just a good touch point to kind of showcase their state, to be really involved at the national level and to give back the foundation. The other thing that we do as far as supporting our foundation with the chapters is we have a day of giving. So Agnes Marshall Walker was one of the founders of our organization, and that's who our foundation is named after. So on her birthday, we have a day of giving, and we actually do a chapter challenge. So whichever chapter donates the most money, they get some recognition and a reward back from ANN. So those are kind of some high level things that we do to engage our chapters at the national level. And then I'll now touch on different things that our chapters are actually doing to engage with their members. So these are just kind of high level. So annual educational meetings, vendor events, charitable endeavors, and social media. So what we have done is really help them engage virtually. So a lot of them are still pivoting back to in-person meetings, but as the pandemic hit and as they found it harder to get together, we actually put together some resources on our website to help them with virtual planning their meetings. So, what we've done is help them say hey, keep your meeting to a few hours, do a hospital hour that can maybe help you use some space. Looking at vendors, who are the reps that are coming to your facility? Ask them if, they want to host a dinner or a lunch. Anytime I'm meeting with a vendor who wants to connect with the chapters, they'll ask me hey, do you do regional meetings? Well, we don't really as a national organization, but we have 53 chapters that meet on a regular basis. Let me connect you with their president. So I know a lot of our chapters take advantage of these vendor events and will participate in those. And as I touched on a little bit before, charitable endeavors. So this is a really big activity for our chapters, and it really does seem to bring a lot of engagement to them. So when I was looking actually at the applications for that award, what I saw was a lot of like organizing of like helmet donations, since we're neuro nurses, that's a big deal. Local activities like a beach cleanup, looking for disease states that support rehab and looking at those. So lots of walks, lots of charitable runs, participation in those at a chapter level. And then, kind of tying that back into our national organization, giving back to that foundation. And a lot of them use these funds, obviously, to support some chapter activities, but they'll do it to send their chapter members to a national meeting, or they'll use it to send them to a local meeting, or really support that education around them. The other thing I've really seen with our chapters is they're really pivoting from a website or a newsletter to social media. So they're setting up a Facebook page or an Instagram for the chapter. They're sharing events. They're posting it, what they're doing. They're posting their activities there. They're trying to kind of engage some level on there. And then they'll also obviously follow the national, and we'll kind of tag them in our post as well. You do get, I know I talked with Anastasia, you guys get a prospect list as well. So we provide our chapters, their current members, as well as a prospect list. So we've been encouraging our chapters to really like push that prospect list, like, hey, follow us on social media. We'll keep that up to date. And one of our chapters has actually shared that they had joined for their hospital's professional organizational fair. So they actually had a table there to promote the visibility for the chapter, as well as the national membership as well. So now I'll touch on some chapter resources that we have. So you can change to the next one. So as I mentioned, prospects list. So I'm a big push of the prospect list, right? So you probably get that a couple times a year. Make sure you're using that. Make sure you're reaching out to your members, telling them about what you're doing, sharing what's going on. When you're looking for leaders, make sure you're using that list to reach out. So we have it sent out with our dues remittance. I know ARN collects dues like we do, so we send it out quarterly and provide that. We also have a chapter mentor program. So early on, we had, a lot of new chapters, or we'd have existing chapters. Their leadership had changed over. They were really struggling. So we actually created a chapter mentorship program where you can reach out to national, and we will connect you with an active chapter who's really, not having a hard time, has a strong leadership, has strong policies and procedures, and we'll make that connection for you to make sure that you have the support that you need. We do offer space at all of our annual conferences. So I'll reach out to all the local chapters in the area and say like, hey, you're welcome to, participate in the meeting. Can I provide you a table? We'll put them right by the national booth, or we'll put them out in the foyer by the registration area, whichever they prefer. But we do try and give them that space to be able to promote their local chapter and be involved in our meeting at whatever level they'd like to participate in. We do have a chapter resource page on our area. So that's where I will update on a regular basis, as well as the staff member who supports chapters, the vendor list. So as I mentioned, we have industry partners, we meet with them a lot, especially when we see, new products coming out there. Like, we really want to get to those nurses in their regional areas. Who can we connect with? So in addition to a personal connection, I'll create a vendor list where they can just log into the resource area and see who in their area is looking to meet with chapters. And then, as I mentioned earlier, we have these quarterly calls to engage with the chapters. And then we also have a bunch of other resources in our resource area. So we have templates for websites, for budgets, planning a meeting, virtual meeting platform lists, advocacy, and other neuroscience nurse resource lists. So those are really the main ways that we engage with our chapters. And I know, we have about 53 chapters, and I will just let you know that probably a quarter of those are doing really well, right? Have strong leadership, engagement. And I would say the others, they still have struggles. So they may, be a little bit less active and just kind of doing what they can. But there's, many levels of it. And I don't know that the expectation has to be that they're all performing at that high level. Sometimes it's just nice to have a regional group that occasionally gets together. So it's kind of, looking at what you call success. But I do know chapters are a big endeavor for people to manage and take on, as well as for the national office to work with. So I did provide my email. I'm happy to provide any resources or answer any questions. I do have some time, so I'll probably hang out on the call for a little bit. And if you guys want to do questions later, I can answer some questions later. Or of course, Anastasia knows how to get hold of me, or you're welcome to reach out to me directly. So thanks so much for letting me join your call today.
Thank you, Leah. That was absolutely great. We appreciate that and appreciate your time. Next, we have the very successful Florida chapter. Karen, the Florida president, was unable to meet with us today, but we're so grateful to have Ann Wilson, the president-elect, to discuss the Florida's chapter's insight to chapter engagement. Welcome, Ann.
Thank you. Glad to be here. Yeah, so from Florida, I guess you can put up our, one of our members did a poster that we displayed, I think the last couple of years at our annual conference to talk about some of our membership benefits to membership. One of them I think that's big for us is our leadership forum. We do an annual leadership conference, and we really try to develop those professional skills and kind of grow some of our leaders from within. Certainly we offer some scholarship funds for ARN supported conferences. Our conference, the national conference, continuing education, CRN testing, we do some scholarships for that. We offer many CEs, usually throughout the year, sometimes more than 100 CEs we will offer on various methods. Over the last few years, obviously, most of it has been virtual, right? We've all kind of shifted to doing a lot more virtual things. We have our chair for continuing education. We have a Florida provider number and a Georgia provider number. So we try to kind of bridge the gap a little bit that way. And we've also recently started doing some things in combination with chapter in Texas, so that we're providing those, you know, and inviting members from both of those states and doing virtual CE programs for that. We do have local districts within Florida. So we do have several. At one point, we probably had a solid 10 to 12 very active districts. I would say now we're probably down to about 4 active districts, but so they are more localized, right? They meet on a local level. Some of them have started doing more in-person meetings now, some kind of a hybrid, some virtual, some in-person meetings, job postings, peer mentoring. Those are some things that the local districts offer, and then kind of feed up through the state chapter as well. Our conference, our state-sponsored conference, we've been doing a 2 to 3 day annual conference for the past 40 years. So that's kind of a, you know, a standard that people, you know, most of our members at least expect, although our attendance certainly has gone down somewhat over the last few years. We had to cancel our 2020 conference because COVID really hit literally like the month before we were supposed to do our conference. And then in 2021, we were virtual. So 2022 was our first in-person conference again. But we had a pretty good turnout, both from attendees and vendors. As the last speaker mentioned, having vendors come and help to sponsor our meetings and our conferences has been very successful. And I think they were just desperate to get in person, face-to-face time with people since it had been so long. So we really did very well there. Again, you know, it's always latest evidence-based practice. So we do that at the conferences. Networking, those of us that have been doing it for a while really kind of feel that face-to-face is a great networking advantage, both locally and statewide. Some of our interest groups, yeah, lifetime relationships. I know some of our members have been part of it for 30 to 40 years. And so they have strong relationships there with their peers. Obviously, we have some access to national ARN, advocacy, the peer-reviewed journal, CEs from our member circle. We do have a website. We've been, and that may be something that one of our weaknesses is social media. We realized that we kind of need to move probably more to social media to try to get some of our younger, draw in some younger new members. So we're working on that, trying to reach out to some other people that have expertise more in that area. We have a pretty active website that is kept up well, so we do get a lot of traffic through our website. What else can I tell you about Florida? Again, we realize that we do need to get some new blood, if you will, some younger folks into our chapter. So trying to reach out that way, writing articles. We've got a communique, so an electronic newsletter that we utilize, trying to keep that up to date, looking at other ways for social media events. We do have some Facebook, especially at the local districts. They utilize that some more. So that's one thing that we do. I'm looking forward to see if anybody else has anything that's worked well for them to encourage new membership. All right, Florida. Thank you.
Thank you, Anne. We appreciate the information. That was wonderful. And finally, we have two members from the Northern California chapter. We have the past president and active ARN member, Donna Williams, and we have the current National Board of Directors member and chapter treasurer, Linda Parks, to discuss their chapter. As well, we have the chapter support member, Marianne Laszlo, who is also part of the North California chapter. Welcome all.
Thank you so much for having us. Donna, are you there?
I am. I was muted.
Okay.
You'd think by now I'd get I'd know how I not to be muted, but that's how that goes. So do you want to go to the next slide? I think, Linda, I was going to go first, right?
Yes.
Okay, so so I have been a chapter member of one sort or another since 1986, and have been in one chapter that's started a chapter. It's no longer in, and my dog is whining, so if you hear her, I'm so sorry. That's no longer in existence. I've been in other very successful chapters. A lot of this is not new. We, I think, have always struggled with who's active in the chapters. A lot of times it's a core that keeps the chapter going. The last couple of years, there have been additional challenges, of course, COVID. Symposiums, we also were ready to do a symposium in 2020 and had everybody set up, and like everybody else, had to shut that down. So that has been an ongoing problem. We have not yet gotten to the point of starting to, hopefully next year, starting to plan symposiums, which had gotten quite successful. Declining membership, just like I think all other chapters and national, that has been a problem, as well as people who are actually interested in being on the board or being on committees to keep the chapters going. And I think that has expanded in the last couple of years. Attendance at webinars has been up and down. Actually, like as I said, in person, we had gotten to the point of having very successful in-person symposiums, and the webinars have been mixed. Sometimes we end up with more people than we thought we would, and other times it's just been a few, even though we've advertised nationally and it's been recorded and it's been offered. The annual meeting, which we always used to hold at conference, and invited all of our Northern California. We had great attendance at that, so that has been more difficult, like the annual meetings for national. That attendance has declined. And then talk about engagement, which is really the key word for ARN, for all of ARN, for all of us, that has been a challenge. People have been stressed over the last couple of years. I think that it's always been a bit of a problem, but it's certainly extended over the last couple of years. We get people who want to be on the board, and then they're not always active in the things that need to be done to continue the chapter. They may or may not come to board meetings. In getting members engaged, getting them to want to come on to the board or want to come on to a committee, finding non-members. And we do get the perspective list from ARN, and I have actually gone on and reached out personally to every person on that list. I have not done it in a year. I need to do it again, but have actually reached out to every person on that perspective list to see if we can engage. That has not been real successful, though I have gotten some responses saying, yes, I would like to be more engaged. And then just the interest of members and whether they even are interested in being in ARN. I don't think it means that they're not interested in being a good rehab nurse, but it's the interest in being involved in an actual chapter or in really engaged on a national level. So those have been some of our challenges. And I'll let Linda talk about our successes.
Thank you, Donna. And I just wanted to let everybody know that our outgoing president, Noetta Hester, is here on the call with us today. She's able to join us, so we're so excited. Noetta, you want to say hi really quick?
Yes, hi everyone. I'm actually taking a break from my job here, so I wanted to make sure I was at least in on it for a little while. And thank you, Donna. Yes, I concur with everything. We've had a challenging year for sure, or 2 years for that, but we have had some really good successes, and I'll let Linda take over since she's on the agenda, but we can talk about our community service project, which personally I'm very proud of. So that'll be my contribution because I've got to get back to work in about 10 minutes. So go for it. Thank you.
Well, thank you so much, Noetta, for stopping by. She was just an amazing, phenomenal leader for us for the last 2 years through COVID. And my name is Linda. As I was introduced, I am the treasurer for our Northern California chapter, and also serving the board on the national level as we're the first staff nurse. So excited and honored to be able to say that. And I like to share some of our successes for our chapter. So once COVID hit, we really shifted over to the virtual webinars. And we offered this almost every month to every other month of the year versus having one symposium that we used to do, spring symposium every year pre-COVID. So during COVID, we offered these educational webinars for our members. And like Donna said, the attendance was very up and down. Sometimes we'll just have maybe like 5 or 6 people, but some months we might have like almost 13, 15, or up to like 22 people. So of course, when we have more people join us, it's a lot more exciting. If you have any questions about like what topics and speakers we had Donna present on engagement once. We also have speakers, but we also used our learning task, the webinars from ARN, and we purchased that, and we view that together during our educational webinars. I know there's a different like purchase system now, but Anastasia probably knows more, but you would pay to purchase the webinar, and it goes by how many CEUs and how many people attend to watch the webinar. So there's great topics there. And so I recommend chapters to kind of look into that. We also did a great newsletter at the beginning of this year, and we shared it with Anastasia as well to be able to share it among our member circle. We shared our community service project. We also shared our opportunity to be a sponsor for Dignity Day in our local homeless shelter / church. And that's a place where we provided haircuts and vaccinations and clothes and food and services and resources to the homeless community here in California, Vallejo, California. And we were able to hold that service maybe, I think we went 3 times. And so there's another one coming up soon, I believe. So we were able to provide service in terms of our time and being part of being there and supporting the cause, and also making a donation to the cause. We also made a donation to the our ARN National, providing the core book, our Rehab the Core book, to, I believe, Nate, do you know where it was sent to, Donna, by chance?
Well, who was distributing it to
Okay.
into European and African nations, I believe, those people who
Yeah.
really needed the resources. And they were it was the previous core that was just going to be eliminated, and we went ahead and paid for the shipping to send it to Europe.
Yes, so that's how we were able to be part of that. And then also social media, like Florida was saying, I wish we were able to engage more people through social. We do have a Facebook, we do have Nursing Network, and that's how we kind of reach out to our members and keep people connected. But it's probably not as active as I probably want to see it. So we're continuing to work on that. And we have committees. So we have one of the really great things that we did in the last 2 years, and Noetta had initiated, where we had separate committees where board members will kind of lead and work with different members. And that included like a nomination committee, community service committee, communications committee, education, scholarship, bylaws, and really focus on, you know, things that we are really working on as a board. So not one committee may always be active, but let's say if we're working on bylaws, then the board and the committee will really be working on the bylaws for a quarter, and then sometimes we'll be working on scholarships, and sometimes we'll be, you know, communications always kind of active because we hold the webinars. But the committees have been tremendously helpful and kept our board and the members engaged. And so it's been a difficult transition, but I think we did really great. And we also had an annual chapter meeting, and you can see the picture there. We held it at Michelle's house. And it was really wonderful to be able to get together post-COVID. And that was our first get together. It was a really nice outdoorsy area where we all got together and shared our what we took from the last ARN conference, and we viewed some presentations as well, some of our favorites from the ARN conference. So we had a monitor outside where we got to see some of the presentations, which was great. And next, Donna will go over some engagement ideas and kind of lead us into some discussion and sharing.
So if we can have the next slide,
Please.
please. So like everybody, we are national and chapters, we are all trying to figure out 2 things, I think, how we engage people. And that caused Linda and I to kind of talk about, why are we engaged? Why is rehab and ARN so important to me and it's not important to the next person, or not only is it not important, but there's no interest at all. So these are things that we kind of were hashing out to figure out what's going on and how we can really engage people. At our last board meeting, we talked about a mentoring program, and that possibly each member who's actively engaged chooses one person to really mentor into ARN. But how do we determine who really is interested? And why they're not interested, and how do we engage them? And one of the things that Linda and I talked about when we were getting ready for this was approaching people, asking how they are and what brings them to rehab nursing, and what do they think about rehab nursing, because I think that's the base. I think that my personal opinion is that people who don't like being a rehab nurse are not going to be into ARN. And so we talked about how each of us really got into rehab nursing, what brought us here. So I'm going to very quickly share you my story. Long time ago, 1976, I was working in the newborn ICU, which I really just was not a newborn ICU person. And so I wanted to leave and go to another unit. And the head nurse said to me at the time, and I had ortho experience. I'd also worked at rehab while I was in nursing school. But she said, "You will not like the head nurse on the ortho unit. So I suggest you go to rehab." So I applied to transfer, and when I got to the rehab unit, it was like coming home. It felt so comfortable to be there. The staff was so engaged in being a team, in really looking at how we could provide better to our patients. It just felt wonderful. So since 1976, I have just been passionate about rehab because the people that I work with, the interdisciplinary team, the chance to get to know patients and to get to know families. I still think about the families that I worked with. I think that's getting to be 45 years ago. It just became so meaningful to me. And I've never left rehab. And even when I have not been on a rehab unit, I've taken rehab to those patients. Linda?
Yeah, so thank you so much, Donna, for sharing your story. And so the reason why we're sharing our story is to, help people identify and feel the love and the purpose for what we do. And when I reflected on my journey here to rehab, to being a rehab nurse, it just makes me tear up every time I share my story. But my brother had a brain injury, and I was never able to bring him home. But it brings me so much meaning to be able to work in a unit where I can help patients and family members to get ready to go home and be able to send our patients to their loved ones. So it just gives me so much meaning for me. Like I wasn't able to bring my brother home, but for me to be able to do that for someone else gives me so much meaning. And that's why I love rehab nursing. And so from there, we went on to continue about how do we share this love and how can we help people really find this love. And so I think this is kind of the hot topic right now nationally and individually as chapters, is having mentorship programs. I think it's wonderful that, I was mentored into the leadership that I have now. And I'm so honored and grateful to have such amazing leaders around me and surround me to guide me and help me be here. And so I keep saying I challenge all the nurses who have the leadership and the experience at ARN, and also within your own organization, to really reach out and help people find that foundation and that love for nursing. And I call that planting seeds, and really planting that seed to help it root and grow, allowing that seed to really flourish and bear fruits, so we could share with others. So, yeah.
That was very touching. Thank you.
Thank you.
I'm just going to say real quick, I know you want to move, but I'm a long-term rehab nurse too, Donna. Go back as far as you, okay, if not further. It is always, and Linda, for sharing, I have found that the most committed rehab nurses have had rehab touch their lives in some way. Family, friend, parent, sibling, you know, the people, no one wants rehab, but if you then are exposed to excellent rehab care, I think it makes very committed people to rehab and the cause. So there's almost that humanistic thing that happens to make those be committed.
And I too have talked to many people who have that in their background, who because they've had a family member, they really understand the purpose of ARN and have become very committed to promoting rehabilitation nurses. And I think I also go back and think just about being in nursing school and why many of us went there and what you learned. And for me, I think rehab is the area where you can do everything you ever learned in rehab. You need to know the anatomy, the pathophysiology, the psychosocial, all of the functional, and it's really trying to get people excited about that same thing. And it might be there. And we're thinking that a one-on-one approach is a really good way to get there. People don't always jump onto the Zoom. I know there's not a big emphasis on conferences these days. And I have to admit, you know, I struggle with, am I one of the older generation that just doesn't want to let that go? But we are very social people, nurses. If you feed them, they will come. So we need to work on that. And one-on-one gives you, I think, a different opportunity to engage people. And so if each of us on this call, or each of us on every chapter board would identify one person, could we really start engaging more one by one? ARN's always done, I don't know if they currently are, so I apologize. They've done a get a member campaign. And does each chapter, is that a thought for each chapter to say, I personally am going to go and find one person to engage and really talk to them about what they do and the joys of being, the difficulties too, of being a rehab nurse, and the positive, the positivity that comes from being actually active in the association. I always talk about the fact that I have friends across the United States because of ARN, and it's just such an important part of my life. And that's all I have right at the moment.
I love it. I love your phrase, get a member campaign. That would be wonderful, something to implement. That is a wonderful idea. We appreciate both of you. That was a great presentation. So we thank everyone so much for all their wonderful information today, and we'll open it up to any questions. If anybody has any questions, feel free to jump in and ask them. I think most of the questions on the chat were asked as we went along, but if somebody has a question, feel free to jump in.
So I see a question about how we how we provided, had our annual conference, our annual meeting at conference, and we just chose a time to have lunch and tried to pick a time where there was not much going on. And I also see the comment about how many employers are not paying for this type of membership or conference attendance. I think we need to, in the past, we've done it. We need to continue to convince employers about the importance of this association, what it provides to their employees.
I have a question for Leah. Is she still here?
I am, yes.
Okay, so I know Donna, she reaches one-on-one to our prospective members via email. And I also heard that you reach out to prospective members, and it's like a very big thing for your chapter. How do you guys do that? Is it email, calls?
Most of our chapters just use email, right? So what I encourage is a mail merge. So creating a Word document and then sending them an individual email so that they kind of get like a "Dear Linda, please come to our chapter event." So we found that reaches their inboxes a little bit more successfully. So we've coached a lot of our chapters to use that method.
Okay, that's really cool. I really like the idea from Florida about having, was it Florida? I'm sorry if it was a different chapter. I think it was you, Leah, actually, was about having a space at the National to promote your chapter. That was cool.
We do. So we always try and include our local chapters. So we'll be in Florida for our 2023 meeting. So I've actually already reached out to all the local area chapters and said, hey, if you want a space, you have it at the meeting, just let me know. So we provide, some sort of table, and they will, bring some materials from their chapter and have a few volunteers man it so that they can kind of engage with the national attendees as well as people in their area.
Hey, Anastasia, I know this is a little last minute, but do you think that's something we could offer to our chapters?
I think that we have.
We have,
Stephanie,
okay.
I think Stephanie Lynn is here. We can hopefully say that we have successfully done that. But I do know that we want their presence there for sure for the San Diego area.
Okay. Traditionally, local chapters have been very active at whatever conference there is. Interesting thought that other chapters could be encouraged to bring a poster or an introduction to, so that people are there and they're just seeing that there actually is a chapter. I know there's sometimes chats about on the member circle, is there a chapter in Indiana? Yeah. I saw that recently, and Illinois reached out to Indiana. That is so cool. So to continue to promote that.
So are there any other questions out there? We have about 10 minutes left, but Anastasia, do you want to move on to the scorecard?
Yeah, I think there was one more question for Leah. Oh. So how many members participate in your all member question? So I
was just responding in the chat, okay. But yeah. Okay. So we actually have about 30 to 50. That'll be way faster than me typing it. We do not provide CEUs. We've talked about it, but really we're looking at networking and engagement. But that would be a good opportunity to offer CEUs. Really, the only cost we have is using our Zoom platform, but that's kind of a standard cost for ANN. So we just use our existing platform to host the meeting.
And I did have one question for Anne, and it was more about where do you get your CEUs that you're providing your chapters? And I guess for everybody that presented, where do you find your CEUs? Are you utilizing the ARN Learning Center? Are you utilizing the discount that we provide our chapters, and I'm just curious where that's all coming from.
So our CEs that we offer usually, I think we have used some of the ARN products before, but we have, we encourage some of our members are expert, subject matter experts on different things. We have enough networking, that we'll get different providers, physicians and whatnot to do. We always, I know every state's a little different on what their licensure renewal requirements are for CEs and whatnot, but here in Florida, we have some specific topics for CE that we need to complete, for our license renewal. We always offer some of those, usually at our annual conference and throughout the year, so that again, for members to find ways to obtain those CEs that are required for their license renewal, for sure. We do.
Thank you. This has been amazing. I hope everybody's pen's ink is running dry with all of these ideas and things that are flowing in this meeting. It's been really incredible to hear everybody. Thank you so much for all participating. I'm just going to talk really quickly about our chapter scorecard. As you all know, that I'm fairly new here. So this was a pilot program that we rolled out, ARN rolled out in 2021. We have Sue Comets on the call, who was one of those who spearheaded this, this initiative. So I would love to get her insight on this, but ultimately what chapter scorecards are, it's not only to honor and showcase chapters that are doing a lot of great work, it's to also be a resource for our chapters. So when you see the chapter scorecard, and again, this is one of the newer emails that I sent you on Monday, it has the newer version. This is really to look at ideas, see what you could be doing throughout the year, and then giving yourself points as an organization. And Sue, if you want to just hop in and talk a little bit more about this and why this is such an important resource for the organization. I don't know if she's there or not. She was here earlier. She may have had to hop off. But this is exactly what you guys had last year. So there's nothing new, not much has changed, but we do want to encourage our chapters to definitely start to do this yearly, look through these ideas and actually use this as a resource. This is on the chapter resource page. And again, this is just a guide for some ideas, and hopefully that this webinar also helped to give you chock full of ideas of what you could be doing with your chapter throughout the year. I've heard a lot of great community service projects. Please share that with ARN headquarters. You can email me directly. We'd love to showcase your photos, your stories, your ideas, everything that you've been doing as a chapter and providing to the outside of the organization. We would really like to see that as well. So anything that you're doing, I will always share it on our Pulse newsletter. I will share it on Member Circle. That would go as far as any of your larger conferences, bigger events. Please be sure to share that with us as well. There's a scorecard. This is separate. So the scorecard will be separate.
I really liked seeing this last year, but I wasn't able to see it before the deadline. But one of the things that caught my eyes was encouraging other chapters to kind of co-host each other or kind of network together in either a board meeting or even a members meeting. I thought that was a really good suggestion from the scorecard.
And on that point, I wasn't on the design part of the ARN chapter scorecard, but what I loved most about it was just what you said, Linda. As you read down through it, it's meant to help those who maybe needs a little boost in creativity to get ideas. It kind of stimulates that. So that's one of the things I really loved about it.
Exactly. This is a resource. And again, it can be found under the chapter resource area once you log in to your account.
So we want to thank everybody for attending today. We're close to our wrap-up time. Please let us know if there are any future topics you would like us to present. And remember, we are always here for you. Scrolling through here are the chapter assignments and your contact folks. So remember, if you do have any questions or concerns, please reach out to your chapter liaison. We are here for you. So we'll take one last, any questions out there? Otherwise, enjoy the rest of your day. Thank you all presenters. That was wonderful.
Hope to see you all in a few weeks.
Thank you all. Amazing. Thank you.
See you at
Thank
the
you,
conference.
everyone.
Thank you.